Joe and
You made it.
had a lot of fun discovering Duluth.
Right, and we spent some nights there.
We did.
That helped.
Most weeks we spent 2 nights there.
Yeah. that helped.
So, I mean, it was.
All right, so it looks like everyone's here. So let's call to order the Public Health and Human Service Board meeting on Tuesday, July 16th. And just a reminder, I see the windows are closed, we've got construction going on, but just a reminder to turn off your ringers and sound on your computer so we do not get interrupted during this very important meeting today. We have some good presentations. And we will start with the approval of the consent agenda.
Make a motion to approve the consent agenda. Make a motion to approve the consent agenda.
Support.
We have a motion, a second. Any discussion? All in favor?
Aye.
Any opposed? Motion passes. And next, introduction of new staff. So we have Matthew and Beth here, if you guys wouldn't mind standing up. Put you on the spot a little bit. Welcome.
Thank you.
Would you like to share anything about yourselves with us this morning?
I'm really excited to be here.
Cool.
Me too.
And we're really excited to have you, so welcome to the team.
Thank you so much.
I just want to say Matthew's been here. This is the beginning of his second week, and this is the beginning of Beth's third week. So they're very, very new and already really becoming integral parts of the team and really doing a lot of great work. And so we're really thankful that they're here and part of our team.
Thank you. All right, staff report, Cook County Child Support and Collections, Dan. He's excited to be here too.
Yeah, absolutely. So good morning, everybody. Like you just said, my name is Dan Polinsky. I'm with Carleton County Child Support and Collections. I was just telling Allison when I got here this morning, I've been here for a little while, 20 minutes or so. This was the first time coming up where there was no construction on the way. So I was very grateful that it was just a nice drive. It's a nice day. It was really easy to get up here today. So the second thing I want to say is I talk fast and I don't have any handouts for you. So if I'm rambling on here, feel free to slow me down. Feel free to ask a question if you have a question. Otherwise, absolutely at the end, ask me all the questions that you guys want. So to start out, I want to say, another thing, sorry, I'm going to be reading off some notes here. So if my head's down, I'm really sorry. I did try to practice this, but I want to make sure that I touch on all the points here. So the mission statement of Child Support for Minnesota is that every child needs financial and emotional support, and every child has the right to that support from both of their parents. So that's where child support gets involved. And so Carleton County has been providing the child support services for Cook County since December of 2013. Per that contract, we agreed to maintain or improve all performance measures that the state measures us on. So there's 5 of them that the state measures us on. The federal government pays for child support. The federal government gives the state a bunch of money. The state doles that out to the counties. The feds want to make sure that we're hitting, performance thresholds. Each state is a little bit different, but in Minnesota, there's 5 of those thresholds that the state puts on the counties to ensure that we're doing the best that we can, best of our ability. Little bit of background on some of the numbers up here. At the end of 2018, Cook County had 162 open cases. So that sounds like a lot with the population that Cook County has, but I want you to know that it's not 162 different sets of 2 parents. Oftentimes a kid may live with mom and then move in with dad, may live with dad and then move in with mom. In that case, we'd have 2 separate cases. If a relative caregiver ever takes a child, or if the child is ever placed in foster care, that could open up another case. So with 162 cases, it doesn't mean that there's 324 different parents out there. There could be multiples on multiple cases. So again, children need the parent support, both the parent support, just like that mission statement said. So what we do, what the counties do, what our role is that we secure enforceable orders. So we establish orders where there's not 2 parents yet, where there's obviously 2 parents, where there's not 2 legal parents yet. So we establish that legal parentage. We secure enforceable orders. So we want to make sure that the obligor, the non-custodial parent, the parent not in the household, has the ability to pay. So that's what we call an enforceable order. We monitor those payments. We provide enforcement activities, and we modify or change orders when necessary. So I'm going to touch on one particular performance measure that we find particularly important, and that's current support. So it's the amount of support due to a family or to a child. That's the denominator, and the numerator is how much are we actually collecting. So basically, it's how good are we doing our jobs and getting that money for those kids and for those families. So again, for federal fiscal year 2018, our number was just a hair under 73% collected. So to give you those total numbers, we charged $376,000 in Cook County, and we collected $274,250. So again, right around 73%. So even with the population size we have, we're talking of, multiple hundreds of thousands of dollars here. So it is a big chunk of money. Yeah, Dave.
Can you give any perspective on that number as far as the state is concerned, like statewide or other
absolutely.
comparable counties? Or
I do have that, if you give me just 1 minute.
Sure. Sorry to interrupt.
No,
the flow.
that's fine. And I did bring it with me. I just got a bunch of paperwork here, so you got to bear with me.
Yep.
Yeah, every year we get a performance report that says how we're doing regionally and how we're doing statewide.
Yeah. That would help me get perspective.
Sure. Yeah, percent really doesn't mean anything without perspective, right? Well, I tell you what, I don't have the state number on here. I have the region, if you want the other counties in the region's
Sure.
numbers.
Yeah, that's interesting.
So keep in mind that Cook was at 73%, Aiken was at 76%, Carlton, my home county, was a hair over 74%, Itasca was almost 77%, Koochiching, and I should mention that Koochiching's like second highest in the state, was just under 83%, Lake was almost 76%, and St. Louis was 73.5%. So, I'm gonna give you a little bit more perspective on the
Yeah, that
numbers
helps a
here.
lot. Yep.
Yeah, so again, that's not the state number, so I apologize.
No,
There's
that's
another
fine.
report that
That's
has
probably more-
every single county.
Most relevant is
Sure.
our region. Yeah.
And actually, I mean, this is off topic a little bit now. The state is looking at not only regions, but counties, and not just putting them under one threshold and having that be the magic number that they want us to hit, but they're gonna look at economic factors, demographic factors, the reservation you may or may not have on a county. Each county is different across the state. We may never be as good as Koochiching County, and that may be because of factors outside of our control. So,
Thank you.
you bet. We have increased that child support number for when we took over 5 years ago. Again, we're at 73% right now. It was 65% in 2014. So we're 8% up. We got a trend that looks like this. Sorry for the audio people who are listening, maybe. This is a visual medium right there. But we did hit a high point in fiscal year 2017. So this is a little bit of why I'm here today. Even though we have an upward trend, 2017 was the peak at just over 76%. Now we've dropped to 73%. I have preliminary numbers from this year that tell me it looks like we're dropping another % or two. So it would still look like an upward trend with a little dip here at the end. So what we're looking at is all enforcement tools that we have available to us to mitigate that, to stop that dip. I'm going to tell you right now that Carlton County is looking like the same thing. We have an upward trend with a bit of a dip here. So we're looking at doing the same thing in Carlton County. So we provide the same services to Cook County that we are providing in Carlton County. So what we're looking at doing is a recreational license suspension project. So I'm going to tell you a little bit about what that is. Pursuant to Minnesota Statute 518A.68, the Child Support Agency has the ability to suspend or bar all licenses, permits, and stamps issued centrally by the Commissioner of Natural Resources, or the DNR. So that could be your hunting license, that could be your fishing license, that could be your small games license, that could be your duck stamps, that could be a boating license, that could be an ATV license. We can suspend those, or we can bar your ability to get one of those. These suspension actions haven't been done here in over 8 years, and I don't know how much further beforehand it had been done. In Carlton County, it hasn't been done in 8 years as well. Other counties do it. Koochiching County, which I spoke about, Koochiching County does this. So it's another tool in our tool belt that encourages payment. It's another, we're not I'd like to say that we're not here to be punitive, but we are here to encourage payments towards children and families. These actions, I'm sorry, I keep saying too, by the way. These actions are all done through the expedited process court. So if you're unfamiliar with the expedited process court, it's a court that is held in front of a magistrate instead of a judge. Usually timeframes are quicker in being able to get in there. Here we have them every other month. So within 2 months, we can get somebody into a hearing, give them their 21-day notice that they have a hearing coming up that allows people to get an attorney if they feel like they need an attorney, or to get their documents together to bring them into court. Those expedited process hearings, I'm sorry, I already said this, but it allows both parents to have their day in court, I should say. There are abilities to default orders through the expedited process court, which means we don't set them on for a hearing, and I feel like I've got all my ducks in a row, and I write an order, I send it to Molly Hicken here, she signs off on it, it goes to the magistrate, and the magistrate signs off on it, and there's never a hearing. In these circumstances where we're looking at suspending recreational licenses, we would want people to have their day in court, so we would always set these on for hearing. To go a little deeper into why we are going to start doing these recreational licenses, this is one of the last, I'm going to say it is the last enforcement tool we have in our belt. When we move forward with these, an obligor must be in arrears of at least 6 times their monthly obligation. So these are people who are at least 6 months behind and are not working with us in any way. They're not working with us in creating a payment plan. They're not working with us in getting their driver's license working. These are people who maybe have disappeared. They're off the grid. They don't have a job where we can do an income withholding for them, but a magistrate has determined that they have the ability to pay. So they are getting money somehow, just not through an employer that we can do an income withholding for. So now we are looking again at this last tool in our tool belt. The other tools that we have beforehand, I keep saying tool belt, I don't know why I keep saying that, but the other enforcement remedies that we do have before we get to recreational license suspension, we will have tried every one of these if these things exist in this person's world. We will do a credit bureau report, which means this is going to be on your credit report. We're going to suspend your driver's license if you have a driver's license. What we've noticed with driver's license suspensions is that doesn't always work. Many people drive without a driver's license. What we've heard from across the state is more people will drive without their driver's licenses than will hunt without their hunting license. We'll do an occupational license suspension if you have to have an occupational license. We'll do a financial institution data match. So we connect with many local and large banks nationwide, and we'll levy bank accounts. If we see that somebody's got 10 grand in their bank account and they owe a couple $1,000s for child support, we'll reach in and we'll grab that. We'll do income withholding like I had stated. So if you have an employer that is known to our system, we'll send an income withholding order and your child support will automatically come out of your checks. We'll do passport denials, and we'll do revenue recapture and project intercept of taxes. So if you're filing tax returns and getting a rebate, getting some money back, we'll take that too. So there's a few other cases in which we would never do a recreational license suspension, and that is if the family is receiving cash public assistance. So if you as the individual owes money, is now on MFIP with another family, if you're getting cash public assistance with another family, we wouldn't also suspend your recreational license suspension or recreational license. If you're receiving Social Security, if you're receiving SSI, we would not suspend a recreational license suspension, or recreational license, sorry. Or if you're, again, working with us, if you're trying to modify your order, if you're trying to get in compliance with the payment plan, if you're working with us, if you're calling us every other day telling us about how much you're trying to get a job down the street and it's just not working, we're not going to be suspending your license. I mean, we're reasonable. We're trying to work. Again, these are the people who are off the grid and we have no contact with them and no ability to have any contact with them. So currently, all that criteria that I had just said, we have 6 individuals in Cook County who meet that criteria. 6 people is what we're looking at moving forward with to begin with. 6 people who we would try to suspend their recreational license. These are people who we also look to see if they ever even had a recreational license suspension. There's no point really in suspending a license if nobody's ever had that license. So we interface with the DNR. We can look and see, yep, they had a boating license and a fishing license last year. We can look at suspending that license. And again, what I want to end on, I think, is that we're not trying to be punitive with this. I mean, child support sometimes gets a bad rap that we're doing all these things, all these scary things that I had said that we can do sound like, we're the big mean government, and we're not that. We're trying to encourage payment. We're trying, however possible, to get money to the children and to those families. So I should mention too that if they do come in compliance then, or they do start a payment plan with us, I'm working with Molly right now on how much we're determining would be, a good faith amount to come in and make a payment, or how many months worth of payments would get them back into compliance. Then we can do what's called an ex parte motion, which is an even quicker motion to get their licenses reinstated. So that people do not need their day in court for that. That is one of those orders that I can send over to Molly. She can sign, get it over to Magistrate Eck here. She can sign. We contact the DNR and say, hey, they're in compliance. And instead of 2 months or every other month where we have a hearing here, it could be 2 weeks and we could get their licenses back. So what we're hoping is that, before fishing season or before hunting season, these individuals do come in and say, oh, here's that couple $100 I know that you guys are looking for. This is the 3 months of the 6 months I'm behind, or something like that to get some sort of a payment. So, and when we're talking about $376,000 that was owed over the course of a year, a few $100s here and there actually does add up. That changes that percent pretty dramatically. So that is all I had.
Any questions?
Yes, sir.
Do you have, that law, does that over tribal members too?
It does not. Nope. We would not be able to suspend tribal members. Nope. They have a different DNR than the state DNR. Yep. That's a good question with Grand Portage up here. Yeah.
Ginny?
Yes, thank you for that presentation. Sure. I was just wondering who actually handles all these cases. Do you out of Carleton County, or do we have people here who?
Nope, this would be out of Carleton County. This is one of the services that we would provide
Okay.
doing the child support for Cook County.
Okay, do you physically come up here then to meet with these folks? And follow
Sometimes.
them?
The magistrate prior to Magistrate Act, Magistrate running, used to say, I like to see your face once a year, so why don't you get up here once a year just so, your presence can be felt. Otherwise, we can appear via video or just via phone. So those are both acceptable ways to appear. And Molly Hicken, or the Assistant County Attorney, is it Jeannie Munson? Sorry, yep, that's it.
It's changed a few times.
There we go, yep. She would be up here and she would be at that hearing.
So the names are submitted through our attorney to you? How do we know about these people? How do we know about them?
We know about them through our child support system.
Okay.
So those 6 people that I had mentioned,
Yes.
we, out of those 162 cases,
Yeah.
these are the 6 cases where they are behind by at least 6 months. They are not working with our office. They have had recreational licenses in the past. So these are the people that have flagged in our system for this action.
And in the meantime, then the children are suffering because of it too, right?
Oh, absolutely,
Yeah.
yeah. That 73% number, as much as I think that's a good number, we always strive for 100%, which is, impossible. You're never going to get 100% of the money that's owed. But absolutely, again, back to that mission statement that every child deserves the financial support from both of their parents. They're only getting 73% of it from one of their parents. So absolutely, I think they're suffering.
Thank you.
Yep.
Jerry?
Do you have some idea about why the collection rate is going a bit downward?
I do not, and I want to apologize because I don't know the Cook County area enough. I don't know if a local business has closed recently that laid off a couple of individuals, or if, because of the Affordable Care Act, if there are less people who are employed full-time, because then they'd have to be paid benefits. I could speculate, and go down a whole bunch of different rabbit holes, but I honestly don't know that answer.
Okay.
Dave?
Do you have any data on like the efficacy of the suspending the recreational license?
No, I have the data from emails that I've gotten where when we were looking at doing this, I sent them to the northern supervisors. So it's the 20 northern counties. We all kind of talk with each other on what's working and what's not working. And the consensus is that this works. That example that I brought up where it's 2 weeks before the fishing season opens, that's when they see somebody knocking on their door saying, here's my money, can I have my license back? So, and that's not ideal. We want the money to come in every month, but again, at least it's something. If you're 6 months behind and you come in with 3 months of payment, at least you caught yourself up halfway there. So it's not perfect, but it's something. And in speaking with Molly Hicken, if our threshold is going to be 3 months, I keep saying 3 months, if they come in with 3 months payments, or if they come in with half of what they owe, if they do that once and then we don't hear from them for another 11 months, they burned us that time. Maybe the next time we're not going to be as lenient and say, okay, sure, just come in with 3 months. We're going to say, you came in with 3 months last time, and now you haven't made a payment in 11 months again. We can't just take 3 months payment every year and call it good. You're going to need to show us, it's called good faith, and it's up to interpretation what good faith payment is. So I would run that through Molly Hicken, and we would look at what good faith at that point would mean for that individual.
Ginny?
Yes, so what's running through my mind is that this mostly is hitting men, or do you have women involved too?
It
as
could
far as
be
the
women.
licenses, but mostly, don't you think it's
The
men?
6 individuals are all men.
Yes.
So as of right now, I'm not saying, there could be
Yeah.
a woman. There are women who are obligors, who do owe, but none of them are flagged right now for
Yeah.
the
And
suspension.
women do hunt and fish and get
Yes, they do.
licenses.
Absolutely.
Yeah.
So, I don't know that we've had a lot of businesses go out, but I don't know if there's a campaign to do or try. As I told you earlier, my other job is bookkeeping, and there's a lot of education that I have with employers when they come in. The trigger is new hire reporting. So anytime an employer hires, they must report to new hire, and that goes out through the entire United States, and you get hit wherever you may or may not owe support. And so I have run into employers who were not aware of new hire reporting, so that gets you behind a couple of months. And then for a lot of businesses, they hire out or they use a QuickBooks program to do their payroll systems, and there's a misconnect there where they assume that QuickBooks is taking care of it, and it's not doing the reporting for them. So I don't know how much that will swing your numbers or affect it, but if there was some sort of outreach that we could do with our chamber or something to remind new employers how important that is. One of the things I told Dan this morning is that when we switched and went to Carleton County for me and my job, it was so great because as soon as that new hire went out, I got the statements from them much quicker because they have much more staff than we had here. It's not that we weren't doing our job here, but I got the paperwork much faster. I was able to get a hold of a person much faster down there. And for me to run payroll, I was able to make those deductions and get those payments in on a timely manner because it doesn't help an employee when they've been out of work for a month or two and then get hit with the arrears and everything else. In most cases, they want to do the right thing also. So just a reminder for anyone out there, if you're an employer, new hire, new hire, new hire. It is important. So.
I'd like to touch on two things that you mentioned there. One of them is thank you for saying how good we've done since we've taken over. I'd like to think that part of that 8% increase that we've seen over the 5 years is our ability with 13 staff I have. There's somebody every day who's the on-call person, so there's always somebody there every day answering the phones, getting those new hire hits and sending out those new income withholdings, stating that these people owe this money. It's
and they're
unfortunate-
very responsive. I mean, they can answer the questions really quickly.
Thank you. The new hire, I think that's a really good point. We say that our information is only as good as we can get. We have a locate system which picks up new hires, which picks up certain things. If somebody starts paying in taxes, sometimes we'll catch that they're working at a place that maybe didn't even do their new hire. But oftentimes we hear it from the ex-wife or the ex-husband or the girlfriend or the boyfriend, or somebody calls and says, hey, so-and-so is now working at, and that's where we get our information. So,
Well, even in our small town, I mean, I just had a customer that had a stack of the reports and it was an employee they had over a year ago, and they're like, why am I getting in trouble for this? And I'm like, you're not in trouble. They haven't been working. And so it goes back to figure out where they are. And I'm like, do you know where they are?
right.
So,
Yeah.
and that's the other thing, they think when they get the stack from your department that they're in trouble, and you're not in trouble. It's
No.
just looking for information and.
We call those locate search. We're trying to locate where these individuals are, where they're working, how much they're making, what they're doing, so we can
Yeah.
do our job. Yeah.
Awesome. Any other questions? I talk fast too, so they're used to
Okay.
it.
Good. Well, thank you guys very much.
Thank you.
Thank you.
All right. Allison, what do you want to do since Rita's here? Do you want to push that up?
Absolutely, if that works for you all, since you're here. Great.
Come on up. Oh, and our new person is here too. How exciting.
Good morning.
Good morning.
Morning.
Thank you for letting me be on the agenda. I sort of kept bugging Allison, so I could just come for a few minutes. And I have no prepared words, so I'll kind of babble along for a little bit. But my main purpose for being here is to thank you. I just have thoroughly enjoyed my opportunity to work with public officials throughout my 38 years. I feel very, very grateful that the Sawtooth Mountain Clinic has had an amazing working relationship with Public Health and Human Services over the years. And I think that, because I'm probably the oldest one in the room, almost, that when Rosemary Lamson retired, which was many, many, many years ago now, and she stood in my door frame and said, "I think you'll be public health for a while." And I went, okay. I wasn't really sure what that meant, but to actually start on that journey, to combine community health centers and reaching out to the public and really being aware of what we can do together as public entity and a nonprofit that at that time was barely surviving, actually, was just a gift in so many ways. And I think the journey of working together, we have a very unique relationship relative to a lot of public health human service departments and federally qualified community health centers throughout the United States. And so I feel very grateful that we've been able to work so well together, and I really hope that that journey continues. It seems to be an ideal way for us to meet our people where they're at and to meet their needs and to truly collaborate. And I think we have done, and I hope to be able to continue to do that to the best definition of that word, and truly meet the needs. So I just personally wanted to come and thank you. I know that these chairs have changed faces many, many times in my journey here, and I've really had the good fortune of working with many of you. And so I just think as a body and public entity who represents all of us to continue to work together with Sawtooth Mountain Clinic, with Public Health and Human Services, and all of our amazing new leaders is a gift for us. It's a conversation that just doesn't happen many places, and I think we are extremely fortunate. So thank you very, very much. And then I know you all probably know my new CEO, but I wanted to invite Kate along to introduce you formally to Kate Zerba. Kate and I have been working together. The board of directors for Sawtooth Mountain Clinic did an amazing, respectful, professional journey through the interviewing process. We had over 125 applicants nationwide. They were diligent, they spent time, and with great fortune, Kate truly, professionally rose to the top. And so I'm just grateful that she decided at the very last minute to apply. And Kate and I have been working on our transition plan, and I think many people know the transition plan, but I just wanted to share with you also that we have about a month left with me in the office, then she and I will be journeying to Chicago for federally qualified community health center meetings together and a new board member boot camp, and then Kate will be taking a CEO Institute learning training session, and then on the 26th of August, Kate returns and will be the new CEO officially at Sawtooth Mountain Clinic, and I don't know, I might get lost in the streets of Chicago. Who's to know? So I really wanted to invite Kate to come, be present, and this will be your new working relationship leader at Sawtooth Mountain Clinic. So I don't know if you want to say a few words,
Sure.
Kate?
I've never turned down the chance to say a few words, as Rita knows.
We both
but
are really pretty big talkers, so you want to.
I just wanted to say
hello, and I look forward to working together. And there are still, as Rita said, has been a long history of working with Public Health and Human Services and Sawtooth Mountain Clinic. And even right now, we're continuing to grow and change how those programs work together. In fact, very shortly, we're heading to another meeting to talk about some of the wonderful programs that we're running with Allison and with Grace Grenager. And it really is a unique and a wonderful relationship that the two entities have, and really does great things to serve our county. So I fully intend to stay engaged with that and continue those programs and continue to grow them as we have been. So that's really all I want to say.
Does anyone have questions? Jerry?
Well, I just want to say thank you, Rita, for being a regular member of our advisory committee. We value you being there, and it's an obviously good connection for us to have, and we look forward to you, Kate, coming to that meeting as well.
Anyone else?
I would like to comment. Thank you, Rita, and thank you, Kate, and congratulations. And when I first moved here, I was amazed how sometimes we were not like this, which I thought it should be. We were like this, competing for things, and just we're here to provide services to the public, whether you're nonprofit or government, and you've done that well. Thank you. It's really great to see. Yeah.
And you all know I don't do words, so. Congratulations.
Thanks, Heidi.
Thank you for everything.
That's all we have.
Thank you.
That's how we do things in Cook County. All right. And we'll back up to director's report.
Thank you. Just want to thank Dan for being here this morning, for making the trip up and sharing these important program updates with us on the child support program and that strong partnership that we have had since 2013 with Carleton County Public Health and Human Services. I also want to recognize our income maintenance team as being an integral part of that process, as well as often being that entryway into child support when a family applies for public assistance, and that's been a really strong partnership and collaboration between our agencies as we work to ensure that children are getting the support that they deserve. Also want to thank Rita and Kate for being here this morning. It's only so often that we're graced with your presence at the Public Health and Human Services Board, but it's great to have you here and to have the recognition again of that strong history that our agencies have had in serving the people of Cook County. So thank you, Rita, for your leadership, and very much looking forward to continuing to work with Kate. So I'll start with always as staff updates. We welcomed 2 new staff in July. Beth Benson was hired as an adult services social worker, replacing Diana White, and Matthew Baxley was hired as our community support worker, replacing services that were historically provided through a contract with HDC. So very excited to have them both within the Public Health and Human Services office. And since we are now fully staffed, I have shared an updated organizational chart with each of you this morning. So the only exception, or conditional exception, I would say, to being fully staffed is that we do have that second public health position that's represented on the organizational chart with a dotted line. We have allocated most of those resources over to the clinic for our purchase of service with the family home visiting program transition. Because of the transition with that program, and because there still are some additional staff resources that we have allocated within public health, it's represented there on a dotted line. We aren't actively recruiting for another nurse at this point, but just assessing as we go into the 2020 budget process how best to continue to deliver those services. And another significant transition with maternal child health. Under items for board action, you approved today the contract with the Community Health Board for the evidence-based family home visiting program. As Rita and Kate mentioned, we'll be meeting later this morning to talk about implementation of that program. So still very much a transition with moving the program to Sawtooth Mountain Clinic, expanding the programming with that evidence-based program in partnership with our regional counties. So a lot of change, but all good things for families of Cook County. Let's see. So agency updates, we shared a draft of the Community Health Assessment, Community Health Improvement Plan with the Public Health and Human Services Advisory Committee on July 2nd. Grace Grenager is working with stakeholders who are involved in that assessment process to continue to review and offer feedback on that draft plan. Throughout the next few months, she will be organizing a series of meetings with groups and individuals in the community, as well as those who indicated that they had a particular interest in working within one or more of the priority health areas as identified by the assessment. And the purpose of these meetings will be to develop the strategies, activities, and partners for meeting some of our goals with improving the health in Cook County. Eventually, there'll be more of a general meeting to present a more complete version of that document to the public. So stay tuned for more information. If any of you haven't seen an electronic copy of that draft, please let me know. We're happy to get that out to you. As I mentioned, we're working on our 2020 budget, so that we'll be able to present a draft to you at our next Public Health and Human Services Board meeting in July, meeting with our important partners like the clinic to talk about budgeting for 2020, as well as with individual units to talk about changes in programming, needs for staff training and travel, what we know and can anticipate for 2020, and what is still unknown at this point. As I mentioned, under the consent agenda was approval for the evidence-based family home visiting program contract. We have also brought forward for approval a memorandum of understanding, which is formalizing an arrangement that was made back in 2017 to exchange some of our funding that we received from the Community Health Board, an equal amount of the Title V and TANF funds, which are funds that are specific for serving families. So we made an arrangement in 2017 to exchange those dollars, an equal amount of the TANF and Title V, with St. Louis County for, again, an equal amount of local public health dollars. And the goal there was to reduce some of the reporting burden that was placed on our agency in reporting for those very small grants. And St. Louis County, as a large agency, was comfortable making that dollar-for-dollar exchange for us. So again, that's just formalizing that agreement that we had made back in 2017. Also want to share with you that we are in the process of reviewing and submitting our new Child Care Assistance Fund plan. This is required every 2 years to review and submit to the Department of Human Services. It will be posted for public comment and review on the Public Health and Human Services webpage by the end of the week, and we will bring a updated plan for approval at our August meeting. And the CCAP plan just really details the policies that we have as an agency and ensuring that those are compliance with state and federal regulations for that program, for both provider registration, payment, and client eligibility for when families are eligible to receive subsidies for their child care. Also happy to share that we've confirmed our initial meeting for the local advisory committee for mental health. Our initial meeting will be Monday, August 12th from 4 to 5:30 at the Cook County Community Center in the social room. After today, we will have 13 confirmed council members. Our bylaws specify no more than 25, so we're really still continuing to recruit and accept applications for that newly formed council for mental health for both children and adults. And this is an open meeting, so anyone who is interested in attending but not sure that they want to commit to membership would be welcome to come and attend that meeting on the 12th and see what that's all about. People are welcome to contact our agency if they have questions as well. The last update that I wanted to share with you this morning is that I wanted to alert you to a number of significant leadership changes at the State Department of Human Services. Just yesterday, July 15th, Commissioner Tony Laurie submitted his letter of resignation to Governor Walz effective that day. Today, Governor Walz has shared that that Pam Wheelock was named as acting commissioner until a permanent replacement can be appointed to that position. Just last week, 2 deputy commissioners also submitted their intent to leave the agency over the coming months. So some big changes at the State Department of Human Services, but no impact on day-to-day operations here in Cook County. We continue with business as usual. And I look forward to having the opportunity to connect with some of my regional and statewide counterparts in the Directors Association to learn more about what this means.
And I talked to Rob Eklund this morning, and he didn't really have any new information to share on it. And so there's going to be a lot of conversations coming up.
Yeah. Those are all of my updates this morning, unless there are any questions.
Any questions? Ginny?
Yes, Allison, getting back to our working with Carleton County, how often is that updated with the contract with them?
It's reviewed annually.
Annually? Okay. So since 2013, it's been reviewed annually?
Correct,
Okay.
yes.
Annually meeting when?
For the calendar year.
Calendar year.
So around this
Jan-
time each year, Dan reaches out regarding our budget for the next year. We've just reviewed and renewed annually each year since 2013.
So basically in July?
In July, but effective for January 1.
January,
So
okay.
both Carleton and Cook County are in the process of developing their budgets for 2020, and based on that, that will be the basis for our payment into the next year.
Thank you.
Yes.
Can we just do a little history for the board? Because it seems like with new commissioners, the reason why we contract out with Carleton County for child support, because we did have it in-house up until 2012.
Yes, so in 2012, right around the same time that I started with my first position with Cook County Public Health and Human Services, our long-serving child support officer took a position with Carleton County Public Health and Human Services. At that point, Sue Footer, as director, hired a new child support officer who was just with us a few months before he ended up resigning his position. And it was at that point that Sue made the decision in working with our region that we have the regional electronic document management system and a regional governance structure over the technology that we use for income maintenance for all of our financial support programs, as well as child support. So we already have some shared services in place with the region, and this presented an opportunity to try something a little different in working with Carleton County Public Health and Human Services to provide child support services to Cook County families. I remember hearing at the time when those arrangements were made that they found that many of the families that they were serving were actually living in Carleton County, so it presented a benefit to those families in having their office be located in Carleton County. We've really been able to capitalize on the technology, again with the shared document system as well as the video technology system to connect families in Cook County with a worker in Carleton County.
And they have larger staff than us.
Absolutely.
And all of the resources, and we had a hard time filling the position, and it's honestly about families. And so the best way to serve our families was to contract with Carleton County. And so it wasn't an easy decision, because we like to have someone right here, and we do have people here where you can come in and make contact and get things started. So
Yeah,
I
and-
think this has been good for our community.
Absolutely. And I was actually served as the liaison to the child support program when I was working in the income maintenance area. So I took a lot of calls during that time of people who were confused or maybe frustrated about the change, but long term, as people got used to the change again, that service, that ability to have someone on call to speak with, when you're a department of one, that's really a challenge in a small community. We historically had just one child support officer because that's all that really was the demand for our small caseload. So again, with programs like this where it's a lot of work over the phone, forms can be submitted electronically, we have the shared electronic document system, it's really been a benefit both to our department and to families of Cook County to have this arrangement.
Thank you. Any other questions for Allison? Okay, we will move on to committee reports. Arrowhead Economic Opportunity Agency.
That'd be me. I guess some of the more bigger things there would have been the executive director, Paul Carlson, will be retiring, and so the search has begun and the transition has begun for his replacement. So that's a big change. He's been there for 23, I don't remember, a long time. I think right out of college he started there and has been there ever since. And then also we have Bev Green representing Cook County on the AOA board, which is really exciting. It's a very relevant position for her, I'd say, and we're really lucky to have her step up to the plate there. And there was a meeting regarding Head Start in the county, and I guess it went well, but it's just not this year, and I think I reported on that already, but that was just something I thought worth noting too, so.
Great. Arrowhead Health Alliance, that's you too.
Yeah, that meeting, I think the big takeaway there was just looking at our region's continuing mental health needs, and with the expansion of service providers in Duluth, we're talking about how can we get this message to them that there are real mental health needs, and that they can be very strong partners in meeting those needs. So that was, I think, kind of the bulk of the discussion. I don't know if there was more that you wanted to add.
The Executive Director, Rick Schaefer, shared with the board, and I don't remember if I've shared this with you. I think I brought it forward to the advisory committee earlier in the month, but that Barb Caskey was hired to replace Savannah as the telepresence coordinator, and as a result of this hire, they're changing that position somewhat to be a regional access coordinator. So that's a very exciting new asset to the Arrowhead Health Alliance. Barb Caskey comes from ARDC with lots of experience in planning, so very excited to have her as a part of that.
That was my next question, because I'm like, I know that name.
That explains why she hasn't been at the transportation.
That's why.
Yeah, and the only other thing, I guess, somewhat related to that is just they were talking about health insurance for the staff of AHA, and so they looked at the counties and the regions' insurance policies, and they're all fairly comparable. So that was just really interesting to see. And yeah, I think that's all for AHA.
Thank you. Bobby, Arrowhead Regional Corrections.
Well, we've been working on doing some outreach to try to get the numbers up for different counties to utilize the facility there, because they seem to be hovering right around 90 people and the capacity is 144. And just like anything else, the budget is the same whether there's 20 people there or 144 at the staffing level. So they're trying to get some numbers up to cover the costs, I guess. And
So
then
how do you do that?
go to different counties.
Okay.
Go to the child support guy. No.
Maybe I shouldn't ask that question.
And then it's just the beginning of the budget season there, and it looks like our share is going to go up a little bit, but not much.
And what are they doing? They've been doing facility upgrades. How are those moving?
They did a big cleanup around there, got rid of a lot of old stuff and some buildings, and they're still planning for the meat processing facility, but the bonding bill, no bonding bill this year, so they're
Okay.
trying to figure that out.
Okay. Thank you. Arrowhead Regional Development, Ginny.
We meet on Thursday.
Okay. Community Health Board, David.
Nothing to report there.
Okay. Public Health and Human Service, Carla and Jerry.
Yes, I wanted to mention the one thing that hasn't come up from our roundtable discussion that we already had, that things that Allison hasn't reported on, is that Frankie Jarko talked about the survey for the highway department, and I think people are trying to get the word out to have people take the survey. I don't know how it's coming in, but, and I did put up a sign in Hoveland and indicated the change in the deadline to encourage people. Okay, and Paula talked about Grand Portage Health and what they're doing, and very interestingly, they have entered into an agreement with the U of M to do a research project, and it's called Memory Keepers, and it's a 2-year grant-funded project in which they will be looking at dementia and Alzheimer's and diseases like that, and they're hoping it will roll over to a 5-year grant cycle. At this point, they're going to hire 2 positions. No, I'm sorry, they're looking for someone to fill that position. In additionally, they are hiring 2 positions for a claims coordinator and a business manager, but they're going to be half-time positions. And they're really on the move right now, is what I'm saying. And also, they got a grant from Northland Foundation to do some planning for a youth project and maybe develop something similar to the Girls and Boys Club model with it. And finally, they are working on a website that would have the tribal programming available. And Bobby, I don't know, does that mean for the band, or does that mean for everyone to look at? I don't really know.
It'll be for everyone.
Everyone, okay. All right, thank you. All right, and Rita was at our meeting and has shared much of what she told you, what she told us about her gratitude in the transition and how happy she is at the person taking over, and so forth. Additionally, she talked about Jack McDonald has retired and that he had been a very significant member, both board and doing a lot of IT things and volunteering, and so you're looking for an IT type individual to fill his shoes, and they were in many roles that he did. They are also, and maybe this has changed, Rita, but you were close to hiring someone for a behavioral health position. I don't know if that's you're not there yet. Okay. Well, the hope is that they might be able to add another person, and they've remodeled the lower level to accommodate that program. And there were some dollars in the budget left over, and so they plan to use the money for ACEs, which is that survey on prior trauma that individuals have. And so they're putting together some programs in order to enhance staff training in this, and also I think there's some effort about eventually into the community doing some things. So they're putting together a program with Susan, is it Bovio, if I pronounce it right? Okay. To do training, and they'll be doing some mindfulness training too with the U of M. And so they will train staff, and then there'll be a foundation that staff will have when they implement working with people as a result of the survey. As they identify new clients, then they will have that tool that they'll be able to use for them. Let's see. And the one other thing that I think in the Community Health Board report that really kind of jumped out was that on July 1st, the laws changed about prescribing opioid prescriptions, so that now it's only for 30 days usually. And the way it works is it's possible some people might experience, unfortunately, a gap in getting their medicine refilled who need it. I mean, it's, obviously the law is to help with abuse, but this will have to be working, I think will have to shake itself out. And we were given a statistic that Rita mentioned, and it boggles the mind that currently the local pharmacy, one pharmacist averages filling 400 prescriptions a week.
A day.
A day, I'm sorry, a day. And they're supposed to only do 100 a day. And so that explains what I think all of us, or a lot of us, have experienced at the pharmacy, and calls for our patients until they can hire, because obviously this is a critical service in our community that we need. And I think that's it.
I wanted to just mention 3 things that Grace Granager talked about in her report to our advisory committee. One, and I'm sure you've seen this in the newspaper, if not in other ways, that the media release went out to announce an RFP for the Cook County Public Health and Human Services Community Fund grant, formerly the discretionary funds grant that we've dealt with in the past. So as of July 1st, the RFP has gone out for local organizations and agencies to submit proposals to provide some critical services relating to public health and social good in the community. Just to reiterate that the goals that people are asked to respond to are access to specialty medical services, behavioral health services, safe and stable housing, services for elders, services for families with young children, and substance abuse. So this will be open for a month, and then after, at the end of July, soon thereafter, a subcommittee of our advisory committee will be getting together to review all the applications that have come in and make a recommendation to you all of the county board on how that discretionary fund money would be spent this year.
And if I may just add, I skipped over this in my report, but Grace held an info session last Friday for the Public Health Fund, open to the public for anyone who has questions about the granting process, how to apply. So Grace put together a PowerPoint that describes the history of the grant-making process up until it was transferred to Public Health and Human Services, how that's evolved over the last 2 years with, again, the subcommittee of the Public Health and Human Services Advisory Committee reviewing those applications and making funding recommendations. So Grace will be posting, if she hasn't already, that PowerPoint to the county website, as well as some of the frequently asked questions that came up either at that info session. It sounds like there were just a handful of people that were able to attend. I think there were 4 people that made it to the info session, but just so that we can share with the public and with you all as decision makers what the types of questions that are coming forward, so that we can address common themes and questions that people have about that process. Grace will also be on the radio at the end of the month with WTIP for a monthly staff interview, just to do one last reminder of the open period for applications.
Great.
Another area of substantial concern to the advisory committee is this issue of vaping and e-cigarette use, the whole concept of adopting a T21 tobacco limited to people 21 or over to purchase in the county. And to that end, we heard about, there was a session, Grace talked about a session held, meeting held at the school, and vaping rose to the top of their concerns in that meeting. There was talk of having a community education panel around that topic. And the comment that the school is wanting support in their dealing with this issue. We talked about presenting this concern, this issue in the T21 to a joint boards committee meeting that's coming up in September, and I believe that's going to be on the agenda to be talked about there. We talked about the importance of having the city get engaged in this issue, and that the success of something like that countywide would certainly be tied to the ability of the city to be on board and pass a similar or the same resolution. The other thing that just want to go back for a minute to the draft of the community health assessment and improvement plan that I probably have on your email attachment somewhere. And Grace went through, at least in a preliminary way, this report that she has written. And the thing I want to say about it is the committee was thoroughly impressed with the work that Grace Granager has done on this. It's really an impressive report, and we're in a stage of reading it and giving her some feedback, and then this is going to be used not only within the county circles, but I'll speak for one. North Shore Healthcare Foundation is very interested and attuned to what this is saying and how our work can align with the things that have been decided and discovered about community health needs and planning. And I'm sure other organizations in the community, or at least I hope others, would be paying attention to this, because it's going to be a valuable document going forward.
Thank you. Allison, can we check with Ben on the DARE program and see if there is any reference in that program to vaping? I know it's a drug program, but...
Turns out tobacco is a drug.
Not as a drug, Dave, but nice try. But just, reaching out to children at a younger age, that's already a program that the children are really receptive to and graduating from, and maybe having just, if there's any kind of program tie into that. Because 12 is too late. Thank you. All right, Healthcare Planning Committee, Ginny.
Yes, well, some things have already been mentioned because we have a wide net of people that meet, Kimber and Grace and Rita, and so I'll just give a couple highlights here. Kimber announced that Mark Abrahamson is retiring, and that's coming up this week on July 19th. Yeah, I think the whole vaping tobacco awareness, Grace really would like to have some more public education on that, and where do you start? You start with the school, or you start with general public involvement, because there's more than just the children and the parents. There's citizens, and there's grandparents, and there's everybody involved, business people and all that too. So that's good that that's going to be pursued. And Jody, with the group of people that she works with, she took a little group to the emergency admittance at the hospital, just so that in case someone would call in that there would be a dispute with abusing a woman, that they would know how to kind of deal with that at the hospital. So that was good to have that area covered. And there again, Rita brought Kate and introduced her to all of us at that meeting. So
Abuse goes both ways.
yeah,
So,
that is it.
all right, North Shore Collaborative, Dave.
Nothing to report.
Emergency Preparedness, Ginny and Myron.
We should be meeting next week.
All right, does anyone have anything for the good of the order?
Yes, I would like to shout out to Tofty Township with the emergency responders and all. They are purchasing a new automatic blood pressure and pulse oximeter machine, which is pretty fabulous, because when they go on calls, they need to know what people's blood pressure and all that is. And they have received many donations toward that, which is great, and will continue to do that.
Will that be in the ambulance?
Yes.
Yes.
Yeah.
Anyone else?
Next Tuesday, I'll be leaving the meeting early, probably like 10 after 9 or so. And myself and Jeff and Rob Eklund and the whole group from the tribe will be heading to Isle Royale for a ceremony, because Isle Royale's become a tribe, recognized as a tribal cultural property now. They're gonna be doing a ceremony over there and be a pretty good group going along.
Hope the weather's good.
And
Thank you. That's huge. Glad we're all gonna miss it. But you'll take pictures for us. All right, with that, we will adjourn the Public Health and Human Services meeting. Thank you.